And here we go. All right, well, for those of you who have joined our second media dialogue, welcome. My name is David McDonald. I'm the Global Media Liaison Officer for a new Internews project that involves 7 different countries. We'll tell you more about that later. But what we want to do is get right to the presentations, because we hope that you will ask a lot of questions. That's what this is all about. This is for you guys, the journalists. So we're going to start with our first presentation is with Eva. And before she gets started, I just wanted to set a few ground rules, which is, please, all you participants, please keep your microphones muted. Please do turn off your video so that we can keep the bandwidth going. And stay muted just because we want to hear what the presenter's saying. Each presenter will speak for about 5 minutes, and then we'll have 5-minute question and answer after that presentation. So your question should be about that particular presentation, directed to that presenter. And please make your questions as short as possible, just so we can get as many as possible in. We have my colleagues Christoph and Julie here to help out with if there's any technical details. But other than that, we should be good to go. Also, please note that we are recording this media dialogue so that we can use it on social media. So if any of you have issues about privacy or confidentiality or whatever, please be aware that we are recording this and we will be using it and sharing it as much as possible. Because as you know, the goal is to help journalists do the best job they possibly can with the COVID-19 pandemic. So that's about it from me. We're going to get right over to Eva. Eva, are you ready to go?
Hi, everyone. Yes, I'm ready to go.
Excellent.
So let me just share my screen.
Okay, I will stop sharing and we'll go over to Eva. For the first presentations, get your questions ready, ladies and gentlemen. Here we go.
Can you all see my full screen? Just to confirm.
Yep.
Yes, perfect. So hello, everyone. It's a pleasure to be here with you today. So thanks very much for having me, and thanks for the introduction. So today I'm representing the Community Feedback Sub-Working Group. And what is this group? So we are a group of partners that are working with communities to help them adopt safer practices, making sure communities have the information they need, and making sure that communities are put center in the COVID-19 response. So we are partners that are working on these areas and that are also collecting community feedback during our activities. And in our group, we discuss the biggest concerns the community members have shared with us, and to make sure we respond to them, provide community members with the right information, and make sure that these biggest concerns are addressed and rumors are tackled. So in our community feedback, we have seen a lot of rumors and misinformation that can be dangerous, that can slow down response efforts. And we have also seen clear information gaps. And a lot of these topics are relating to trials and treatment for COVID-19. So we are here to discuss with you because media plays such an important role in the response to COVID-19. You have tremendous power to influence people's opinions and behavior, and you can avoid misinformation to be spread. So this graph you can see here on the slide shows the results of a survey conducted by Geopol in the beginning of the response, and it found that 2/3 of people surveyed in 12 African countries were consuming more media than before. So people really turn to media to receive information on COVID-19. So it is clear that you journalists play a key role in the COVID-19 response, and that what you cover can have a big impact on the progress of the response and on people's behavior. So this is why we are here today, to discuss what communities have shared with us and to see how these rumors and these concerns can be tackled and the questions responded to, for communities to protect themselves and play an active part in the response. So what are the areas that we have mainly heard? And I'm sure this is not new to you. So there were questions about how to treat COVID-19 in general. So what can one do if one has COVID, and how does that work in rural areas if there is no access to health facilities or practitioners, for examples? There were also a lot of rumors and questions about the availability of medication. So some thought that or think that the medication exists but is withheld. They ask why people can recover if there is no cure. And also, like here, an example comment from Kenya asking about the cure that is supposed to have been found in Madagascar and when this will be used in Kenya as well. There were a lot of rumors and questions, or are a lot of rumors and questions about chloroquine and hydroxychloroquine. So in the beginning, more about chloroquine, now more about hydroxychloroquine. Again, an example comment from Kenya about hydroxychloroquine being a solution to COVID-19 and asking for Kenya to do a study to find out more about that. Other topics were also reliance on traditional medicine. So a lot of people have were saying or are saying that they would be using ginger, garlic, hot drinks, or traditional herbs to cure COVID-19, or would do so in case they fell sick. And also the belief that COVID-19 can be treated just like a common cold. So for example, a comment from South Sudan saying that the disease can be treated or cured with cough linctus. And also a lot of mentions that alcohol or heat can kill the virus. So a person in Rwanda saying that one should just drink a lot of alcohol to cure it, or a person in Burundi saying that one can drink hot water to destroy COVID-19 in the body. These are really just example comments. These topics have come up across the region and were shared by many partners. Why does this matter? It matters because if we don't address these issues, people might think they're on the safe side, relying on their own ways of treating COVID-19. But also their mistrust in the government or in humanitarian organization can be increased if they feel that a treatment is withheld or there is unclarity about the trial processes. And this can then lead to them not following preventive measures, not listening to health information, or maybe even adopting unhealthy practices such as drinking a lot of alcohol to cure or prevent COVID-19, or using medication that has negative side effects. This will then lead to a faster spread, or this leads already to a faster spread of the disease, which means that more people will die and the hospitals are overwhelmed. And this also results in the pandemic going on for a longer period of time and having an even bigger impact, negative impact on the economies in African countries. This is all from my side. Over to you for questions.
All right, well, thank you very much, Eva. That was a great presentation, and it just cannot be said enough how the role that you, the journalists, play in getting the right information and combating the wrong, the misinformation. And we also try to make these media dialogues based on what Eva and her team and all of our partners, when they identify a rumor, then that's what we try to make our next dialogue about. So please keep that in mind. We will be having a poll in a little while asking you to decide on what the topic is for our next media dialogue, which is on September 9th. So think about that. So I see that Emmanuel, you have your hand up. Do you have a question? And we'll go over to you. Yes, Emmanuel, no, Emmanuel? If anybody has a question, this is the time to go for it. Let me know. You can put up your hand, the little blue hand in there. Otherwise, we will, otherwise I'll come up with some questions, but this is more for you to find out what, find out more about how we collect rumors. So I have a question, Eva, if you could go back to the, I think it was two slides before. Yeah, on this one here, you know, it's hard when you say that in remote, I'm looking at the first one. As a resident of a remote and rural area, I want to know more about how we fight. Yeah, that one here. It was from Somalia. You know, what do you do to address cultural beliefs and traditional beliefs that people believe in when it comes to trying to convince them of the science of COVID-19?
Yeah, thanks, David. That's a great question. So this is incredibly important, especially in Somalia, where religion plays such an important role. So in our activities, we make sure that we are working with religious leaders, with community leaders, those people that have an influence on communities and understand the local context. It does not make sense if one comes in as an outsider and says, yes, there is this disease and this is why you have to do this. It needs to be linked to religion. So for example, we like some of our partners have also developed scripture, like key messages with scripture references, making sure that this is explained using references to religion, that religious leaders explain, cover these topics in during their meetings, advise their community members on how to best go about it. And of course we also don't just talk about providing information, but also like how can people share their views and how can we find solutions that make sense for the specific community. Sometimes advice such as do practice physical distancing is incredibly difficult for people because they don't want to preach traditions or don't want to be disrespectful if they don't shake hands with elders, for example. This is why it's so important to work with these influences and work together with community members to find solutions that work in the specific context.
Excellent. So we hope that all you journalists are going to go away from this media dialogue with very specific, practical for you to help you with, and that's one of them is identify the influencers, talk to them, and see how you can communicate effectively. So I think we have one question from Simone. Yes, Simone, are you? Do you have a question? No. Okay. All right. Well, unless you guys have questions, you know, you're journalists. That's what you're supposed to do. But oh, hold on. We do have one from Dr. Shanta Katak. Go for it, Dr. Shanta.
My question is, shouldn't we link up religious leaders with traditional healers in order to influence the communities who are far away, where the people, when they are sick, they really reach the traditional healers. When they are sick, they will go to the healers. They will not go to the religious leaders, probably.
Okay, well, yes. Thank you very much. That's a good question. Yeah, traditional healers. And Eva, try to make it quick because we want to get on to Dr. Fu. So
I'll be super quick just to say, thanks so much for your question. I completely agree. And this is actually also a recommendation we are making. We need to make sure who people turn to, and we as traditional leaders often trusted people, we need to make sure that we are working with them and make sure they have the right information and we find solutions together. Absolutely, great suggestion.
All right, excellent. Well, thank you very much, Eva, for that presentation, and thank you for the question, Dr. Shanta. We are now going to move along to our next presenter, which is, and I hope you can see my screen now, we have Dr. True, who's going to be talking to us. Dr. True, are you all ready to go? Hello, Dr. True, can you hear us?
Thank you. Thank you. Yes, I'm ready to go.
All right, take it away. And we have the slideshow. Julie is taking care of the slideshow. So here we go.
Okay, thank you. So in an effort to address some of the rumors that were picked up from the community feedback, there were quite a number of questions or rumors circulating about the treatments and trials in COVID-19. Next slide, please. Thank you. So I think we all know as of now, we are past 23 million cases globally with over 800,000 deaths. And within the African region, we have now surpassed the 1 million mark in terms of cases and over 20,000 deaths as well. Next slide, please. So I think Eva has already addressed some of this. These are some of the questions that we've been getting, or some of the beliefs that have been coming across. Next slide, please. So if we look at the current trials that are ongoing, or research for therapies that are ongoing, I think the key one to highlight is the Solidarity trial, which is an effort by WHO and partners to do a consolidated effort where you have patients recruited from over 21 countries around the world, and different treatments that were thought to work were tried on them. So the current ones still on trial are remdesivir, which has previously been used in Ebola, and this is showing a bit of promise, but it's also not universally working for everyone. And I think the other big question had been around hydroxychloroquine. But we saw from this extensive data that was collected from the Solidarity trial, as well as two other big trials in the UK and in France, it became evident that it's not showing any benefit in reducing mortality of COVID patients when compared to just standard care. So it was dropped from the trial because it's not found to be working. This is despite, I think, a lot of commotion recently from some people purporting that it's the magic bullet, and really the evidence has shown that it's not. Next slide, please. Thank you. So I think the other big question was around the herbal therapy from Madagascar. So this COVID organics is what it was called, and it's an extract from the Artemisia plant. And this is usually the main ingredient in many of the anti-malarial drugs that we use in the region. So now the effort was to try and see if it would work in COVID. Unfortunately, there was not extensive testing done before it was disseminated for widespread use by the government in Madagascar. And if it was the magic bullet, then up to this point, we should have some evidence that Madagascar is having a limited number of cases, or they are quickly recovering. And I think their cases and recoveries seem to be at par with majority of the rest of the region. Now they're having about 14,000 cases, and they've also had a number of deaths. So it's also not the magic bullet, and we can't really advise the use of it without further testing. So discussions are ongoing between WHO and the president in Madagascar to encourage them to do more testing before they brand it as a magic cure. Next slide, please. So I think the main concern about these herbal therapies, other than the COVID organics, is it gives basically false hope or unsubstantiated hope which makes people less adherent to other public health measures. So they don't see the need to wash their hands or social distance if they know they can just drink this and they should be fine. I think the other issue is with herbal therapies is the concentration is not really standard, so it's difficult to apply it across the board. And this being an extract of Artemisia, that's in a lot of our anti-malarial drugs, if we don't use it properly, it can lead to increased resistance to these important drugs. Next slide, please. Okay, so what message do we need to be getting across to the public? So one is that COVID is real and it's here and it's likely to be here for some time. I think the other key issue is there's been a lot of disbelief because there are people who don't have symptoms. So yes, a large number of people may not have symptoms or may have mild symptoms, but they can still transmit the infection, and they may transmit it to someone who's more vulnerable, who then goes on to have severe disease and dies. So I think other therapies like dexamethasone that have really been hyped are really targeted to those with more moderate to severe disease. Okay, moderate to severe disease, and it's also working, reducing that for about 30% only. Okay, so it's also, so far we have no effective therapy for treatment or prevention, and there is no traditional or non-pharmaceutical treatment that has been proven to work as of now. The other question is around...
excuse me, Dr. Chu, let me jump in with a quick question there, because I think that last statement you just said was really the epitome of what some concerns are. Like, for instance, we have a question on the chat from Khamis about, these are World Health Organization, are big organizations. Why is it, the question is, why is it that it's taking them so long to produce medicine for the coronavirus? How would you answer that question?
Thank you. That's, I think the bottom line is it's a virus, and viruses continue to mutate. So which means they change frequently. Okay, so which makes it very difficult to produce a treatment that would be effective against it in all its forms. Yeah, we are still trying to find a cure for HIV, which has been with us for over 20, 30 years now. So it will still take some time to find something that can work effectively in suppressing this virus, which is why the focus now has been more towards the vaccines. I think that would be how I would answer the question.
Okay.
So, and
that's a good one, but we got another one here, and we have just a couple of minutes before we're going to get on to our next presenter. But Dr. True, you mentioned the magic bullet, and everyone's hoping for a magic bullet, a cure, a something that, but it doesn't exist, right? And a lot of people are working on it, but there's a lot of misinformation about any kind of, if you hear about a magic bullet, it's magic. Is that a fair statement?
Yes, that's a fair statement. So as of now, we don't yet have a magic bullet. We don't yet have a cure-all or a preventative therapy for this particular virus as of now. Yeah.
Great. And then here's another question from Onan, which is kind of a follow-up one. And then it is, where's the first trial of the COVID-19? When you talk about trials and treatment, when's that going to start?
So this have already started, and they've been extensively from the time the outbreak started in China, and now this the solidarity trial that I mentioned is taking place in countries around the world. With over 100 countries are interested, and so far we have people from up to, I think, 29 countries that are involved in this trial. So these are ongoing.
Great. I have one other, well, wait, I think we have Dr. Shanta has another question. Let's see what, Dr. Shanta, go for it.
Thanks, David, for letting me ask. Interferon is a part of the cytokine storm that happens with the COVID infections. And it is being put as part of the therapy. Like, is there a conflict of response?
Um, that's a good question. So yes, it's part of the cytokine storm, but your body is usually able to modulate. So it produces both cytokines, which are substances that are supposed to help to up your immune response to an attacking either virus or bacteria. So the interferon is used. It's not being used solely. It's used in combination in the trial with lopinavir ritonavir, which by itself was found not to work. But it's immune modulation, which means it helps to regulate your immune response, which is the main issue that's causing many of the complications in COVID-19. So it's not really working against it, yeah.
All right, well, thank you very much, Dr. True. And I'd like to thank everyone for their questions thus far. We're going to now do something a little bit different, a little radical. Maybe not too radical, because everyone, I hope you might be seeing me now on the screen, because I am going to actually do something incredibly radical, and that is, we are all here. You're journalists. We're here talking about health. How do you deal with this this very difficult situation we're in? How do you get the right information? But sometimes we forget about our own health, and that sitting in front of a computer for 8 hours a day doing Zoom meetings and this meeting and that meeting, that's not good for you. So what I would like everyone to do, wherever you are, is I want you to get up. I'll lead the charge. You do not have to turn on your mics or your videos, but I want everyone, we're going to take 1 minute and we're going to get up, walk around, jump up and down. You are welcome to dance, and I'm going to lead the charge here. Maybe next time we'll get some good music for you. But it's time, you got to get the blood circulating. So would everyone please stand up? We're just doing this. This isn't a break. This is just 1 minute of health, real live practical health. So we're getting around, we're moving around, we're doing some stuff, get the blood going. That's what we're talking about. And if anyone thinks that this is a good idea, and you know how to put up that little blue thumbs up in the participants window, go ahead and put a blue thumbs up if you think this is a good idea on how to get the circulation going and try to stay healthy in this during these strange times. I'm not seeing any blue thumbs up, so maybe this is a horrible idea and everyone likes to sit on the seat and not do anything. Is that true? No thumbs up? There we go. There, I see one thumbs up over there. Oh, they're starting to appear. I think you can also do thumbs up in the participant window. If you click on your thing, but I'm seeing them. We got a few, we're communicating. Thank you very much for that little break. And that is when we also are going to introduce our poll. We have a poll that we're going to keep open now until the end of this session, which ends at 4:50, which is in about 25 minutes. So we're almost on time, go figure. And the poll is about, we would like you to decide what the next topic is for our September 9th media dialogue. So I am relaunching the poll now. You are welcome to take it whenever you want. It's going to be open all the way through the end of this thing. Go at it. And we are now, if, I want to confirm if Nasibo, I saw you come in. Are you here?
Yeah.
Excellent,
Yeah,
ladies and gentlemen. All right, great. Nasibo is in the building.
Yes.
Let me go over to a quick little intro here.
I just want you to,
Yes.
the 2 slides that I had.
Well,
Just open the 2 slides.
Julie,
No.
Julie's on
Just
standby
the 2 slides,
to help you.
news presentation. just the 2 slides, yeah, 2
Right, we got you.
slides.
Julie is on standby red alert to get your slides up. There she goes.
Mm-hmm.
So it's going to, as soon as we get them up, there we are.
Okay.
Which ones would you like to show?
In terms of the links. So the
This one?
first thing is, if we say there's no treatment for corona, and then here comes 2 people who say, you know what, we were cured from coronavirus. That was the biggest news we had in Kenya. And we as journalists had to go back to say, you know what, it took 500,000 to treat them. There's no treatment for corona. We had to go back and say, you know what, it cost this much for what do you call this? For the PPEs and all that. So yeah, we had to really go back and say, this is, you know, there's no treatment, but you can be cured for corona. And that took a lot. Yeah. The next thing is as far as a hydroxychloroquine. I'm sure I could do more than 20 slides. Today hydroxychloroquine is good, tomorrow hydroxychloroquine is bad, tomorrow it's good, and the next week it's bad, the next week it's good, the next week, yeah, you know. In as far as hydroxychloroquine, we imported a lot, thinking that in our clinical trials we're going to use hydroxychloroquine, but that was detrimental on our part. And what does that do to us? You have to wake up as a journalist the next day and say, you know what, information I gave yesterday was misinformed or did not come from a good point of judgment. And that's where it's very hard for you as a journalist to say, you have this information, the next day you say, you know what, I was wrong. So that's why you have to be, everyone, as far as COVID, even the political writers have now become health writers. So they have to struggle on how to understand the contradicting studies. If a study is on its first phase, that means they just got the first, you know, they just got the, what do you call this? They just call the people for clinical trials. That doesn't mean much. So you have to be very careful in as far as how you get the information and how you transcribe the information. So just because, and then that's the thing, it has to come from, some people will send you a press release and some people will send you the entire scientific, what do you call this, scientific research. So press release are always, as a journalist, I'll always tell you, press release are always good on our part, but not right. Yeah, so you have to look out for that. You have to look out for transparency. You have to look out for which phase it is in. The first phase will just mean that, you know what, they recruited people. That is just what it means for the first phase. And then you always have to have a circle of scientists. Ask them, I got this information. Do you think this is right? Do you think in as far as this information, are we there yet? Just ask as many questions as you have to before you go into writing information. And then when you go to writing the information, you have to say as much as possible in as far as let your audience know the experience, let your audience know how many people were in the trial, how many people were affected, what side effects were there to the trials. This is what people want to know. Yeah.
Nasibo, thank you, Nasibo. That was that you've hit a couple.
Yeah, and I am done. Can you imagine?
Yes,
5 minutes?
thank you very much, Nasibo. That was a nice one, and you brought up you brought up a bunch of great points. But one of them two of them that I want to highlight, and I'm going to throw in a question that we have on the chat group, and that is the reliable sources. You need reliable sources. You need trusted, reliable sources. And as you said, you get a circle of scientists around you and ask the questions, because, you know, a press release can come from anybody and they can try to put out whatever they want to put out and try to convince you of whatever they want to convince you of. So not trusting press release, or at least following up on asking if it is correct information. That's what it's all about. That's critical. So thank you very much for bringing that up. Yeah. So the question that I have for you, Nasibo, actually comes from, where are we at here? Yes, from Emmanuel. Says, how long do you think, from the information you have, from reliable sources that you have established as a journalist, how long do you think this virus is going to be going on? How long will you be reporting on it? What do you think, Nasibo?
Wow, that's a very interesting question. From here in Kenya, we anticipated that we're going to have a spike in as far as our infections in September, but we're seeing a different curve. So I don't know. I can't honestly tell.
Yeah, that's a good answer, because that's what a scientist would say too. Anyways,
Yeah.
thank you very much, Nasibo. That was awesome, and we appreciate your insights as a journalist. And now we're going to move on to our final presenter, which is going to be Adele. And Adele, once you give me the green light that you got your presentation all up, which it looks like it's up, we're good to go. Adele, take it away. I think we're not hearing you, Adele, if you're on mute.
Okay, can you hear me now?
There we go. Excellent. We can hear you. Ladies and gentlemen, Adele is going to bring it home.
Okay, thanks so much, everybody. It's a great pleasure and a privilege to be part of this great dialogue. So I'm going to look at prevention and treatment trials a little closer. And I'm going to look at what journalists should know about these trials. So one of the first things that I would first of all like to talk about is that we've spoken about drugs and we've spoken about the kinds of rumors and myths. And I want to actually address the kind of thing that is happening with the vaccines, because believe me, with the COVID-19 vaccine coming, let's hope it will come, there are going to be myths and rumors around the vaccine if they haven't started already. This is a photograph of a protest group that assembled outside Johannesburg, the University of the Witwatersrand, where the launch of the first trial in Africa was announced. I'm referring to the AstraZeneca Oxford trial, which started in Johannesburg. Just by the way, since then, there have been another 2 trials that have been registered and are going to be starting in September in South Africa. So that's a nice story for you already. Why I worry about this is because this kind of spreading of myths and rumors is going to create vaccine hesitancy. And vaccine hesitancy is something we cannot afford, because vaccine hesitancy can spread to routine immunization programs. In other words, those immunization programs of children that are already happening in our countries. So it's something to watch out for, and it is something to guard against. Be careful with this one. So I want to talk about the knowledge gap, because I want to ask myself, why do rumors happen? Why do myths happen? What is going on actually? So we have been told today by many of the speakers that there is no cure. In other words, there are no drugs, there are no treatments. I'll come back to that. There's no prevention. There is no vaccine for COVID-19 as we sit here today. The problem with that is many people actually want answers. They don't like uncertainty. None of us like uncertainty, because what uncertainty does is it creates fear. And for me, uncertainty and fear bring together the conditions for myths and rumors. People want to fill that knowledge gap. So what they do is they jump in, and then all the rumors and the myths start spreading. And I like to compare it to a uncertainty and fear create, like what I would say is compost and manure, which allows rumors to grow. Once those rumors are rooted in communities, they are very, very, very hard to pull out, as we have already seen and are experiencing. So for me, journalists need to ask this question: is there, or has the vaccine that you're talking about, the drug that you're telling me about, the herbal product that you want to tell me about, has it been tested in a clinical trial? If the answer is no, then you need to be very skeptical about what you are hearing, because unless it's been tested in a clinical trial that is scientifically proven, either it's going to be effective or it's not, then you cannot report on it as if it is a cure or a treatment for COVID-19, no matter what people are telling you. So you need to be skeptical if it has not gone through a process of clinical trials, and we will come to what that means later. But what are you going to do about the people that are left without an answer? You as journalists, and I believe it is our role and our responsibility to give them information that they can use that will be of benefit to them. So there may not be a cure. There may not be, at this point in time, an effective treatment, okay, to deal with the problem. But what you can tell people in the meantime is to do the kinds of things that are going to protect them, that we know to date are clinically proven to protect people. And what is that? It's distance, it's masks, etc. So we can fill that knowledge gap with information. Very important to do that. Okay, so just because there is no cure yet, and because there is no absolute silver bullet, as we call it, all right, there's still a lot of stuff to write. There are hundreds of ongoing COVID-19 clinical trials. Somebody asked the question, when are the trials going to start? They have started already, and I'm going to show you where you can start looking for them. There are also many myths and rumors that are going to still come around. So watch out for those too. So how do you fill the gap? Well, you fill the gap with the information that I told you to remind people of how to protect themselves in the meantime. You start debunking rumors. Very importantly, how do we debunk rumors? We debunk rumors not by just repeating them. Very important. We debunk them by saying, who is the source of the rumor? And actually, it's very good to find out who is behind the rumor, because often you find that it could be maybe a political party wanting to spread rumors about the other side, saying that they're not doing a good job. It could be about people being paid to stand in a protest with myths on placards. And it could be around jealousy. So just do what you are taught to do and what journalists do. Find out. Ask the questions, find out. Then I want to ask you a question. How do you debunk? You debunk with sources. Are your sources credible? Who are your sources? Are you talking about what the CDC says? What about the virologist at the local university or the vaccinologist? What about the epidemiologist? Those are evidence-based scientific sources. Very, very important. If you don't have them, now's the time to find them. So get on with that and always question who, what, when, where, why, and how. That is what we are taught to do. So coming to trials, I want to make the point that it is a very, very rigorous procedure. So if you have a treatment or a vaccine, it's got to go through what we call a development cycle. It starts off in preclinical trials. That's where we do it on animals. And I'm not going to have time to go through this, but we can talk about it later. So these trials are from naught to phase 1, to phase 2, to phase 3, to phase 4. And even after that, there are a number of procedures that take place to make sure that the drug or the vaccine is going to be put out there in the safest and most effective possible way. Okay, so then the next thing is that some information for you, those of you that don't know anything about what's happening with the trials. Very importantly, the New York Times is just one example. And here's an example of where you can find a vaccine and a drug trial tracker. So here you will see that there are 135, this is for the vaccine, there's 135 vaccines that are busy in animal trials. That means that they've never been tested in humans, but there are 21 that are in the phase 1 of human trials, 13 phase 2, 8 in phase 3, and 2 have been approved. Now, very careful. What does that mean? You may have heard about the Russian vaccine that has been the Sputnik 5. That has been approved in Russia. It has not been approved across the board, okay? And there's a great controversy around this trial because it hasn't actually been through the entire clinical phase procedure. It has not been through a phase 3 clinical trial. If it has not been through a phase 3 clinical trial, best don't go near it, okay? It is not the answer. We do not have the answer yet. CanSino Bio is another vaccine that has been approved in China. And for a very small group of people. What does that mean? That does not mean that we have it for our populations in Africa. That is something that they are doing in country. I honestly would not want to go near a vaccine that had not completed the phase 3 clinical trials and the procedures after that. I would not want that. Okay, so moving on, there is
Adele,
one for the drugs as well. Are we finished?
Adele, one moment. Let me just jump in real quick because we're kind of almost getting very close. Is your PowerPoint here going to be available? Can we get copies of it to send to any of the interested participants?
Yes, I'm sure. We just need to can we talk about that afterwards?
Well, okay, yeah, just that we're wrapping it up in about 2 minutes, so go for it.
Okay, that's fine. So just very quickly, there is one for the drugs as well. So you can see what the name of the drugs are. You can understand how far the trial is. Is it in a phase 1? Is it in a phase 3? You can see over there that they've got the not the promising ones. And I can tell you something that under the not the promising ones are hydroxychloroquine and lopinavir and ritonavir. So you can actually see what is happening in the world today with regards to the trials. Very important, I want to finish here. You need to do your homework. You need to know what questions to ask. You need to make the science accessible without losing the facts. Doing your homework means that you need to know a field of research. You need to know what happens in those vaccine trials. You need to understand vaccine development. And also you need to understand the new technology. When I say a vaccine is safe and effective, what does that actually mean? You need to find that out. You also need to find if a trial has been approved in your country to go ahead. And then of course, there are so many stories out there to be writing right now about the issue of vaccines and drugs, specifically vaccines at the moment. Thank you. That's all I wanted to say. Very fast, but yes.
Very fast and very brilliant and very full of very good practical tips for our journalists. And that's what this is all about. So I'd like to say thank you very much, Adele, for doing that. I'm afraid we're not going to have question and answer time, but anyone who does have a question for Adele, please, you can send it to me. You have my email from the links in registering for this. We'll get your answers for you, and we will carry on this dialogue on September 9th when we have the next one coming up. So, ladies and gentlemen, as we said, it's going to start at 9 o'clock, or excuse me, 4 o'clock, and it's going to end at 4:50. And guess what? It's 4:51. So we went 1 minute over, but that's all right. So this is the fact sheet that we'll also be sending around to you that they came up with, full of all kinds of information. Again, thank you very much for participating in this second media dialogue. We look forward to meeting you at the next one. And we're signing off from, I'm actually up in Minnesota, signing off to all of you wherever you are. Thank you very much.